Friends, welcome to my channel Neurology Videos Learn by C. Today we will discuss about important topic, that is the speech disturbances. Firstly, one thing should be clear that speech disturbances, it can be of two types. Firstly, it can be dysarthria or aphasia. What is the difference between the both? Dysarthria means it is a difficulty, patient has difficulty in speech because of the articulation disturbances, and in aphasia it is a basic defect of the language. And the language, it can be the difficulty in reading the material or in writing the material or in difficulty in understanding the speech, the spoken language. Okay, so whenever you are testing the speech in a patient, never ask questions like which will give the answers like yes or no. Always ask the questions which give you the descriptive answers. Okay, like you can ask him, tell me about your job, and or tell me about your family. In this answer, patient will give some, will try to answer it in 4 to 5 sentences. That will give you about some cue what is the problem with this language of the patient, or what is the different difficulty. Is he having an articulation problem or is he having a language problem? Secondly, you can show him the picture and ask him to describe the scene. I will give you the picture, and this is the picture which is basically shown, and you will ask the patient to tell what is happening in this picture. Now when you're testing the patient, you have to, what are the things you should take into consideration? Whether the patient has problem with word finding or not, that is, he's not able to describe the things because he's not getting the words. Secondly, whether he is having normal articulation, that is, he is able to speak normally but the word content is less. Okay. Thirdly, what is the sentence structure normal? Number fourth, are the words which he's using, they are correctly used? Is there any paraphasias or neologism? Side by side, you will see that whenever he's speaking, is there any asymmetry, facial symmetry is present or not? And whether, when if the patient is having is left dominant, whether he has right sided upper limb is moving normally or not, that is right hemiparesis along with the speech disturbance, it tell you about a left MCA territory stroke. Then see what is the body language of the patient. Normally patients who are having aphasias which are non-fluent, they have a very expressive body language. They try to express the things by gestures. They have difficulty with the word finding, but they will try to give you the answer in their gestures. So they will have very expressive body language, whereas the body language in patients who are having pharynx aphasia, it is normal. Okay. And lastly, important thing is that whether a patient is aware or not aware of his problem. Okay. Patient has dysarthria, then his language content will be normal. What will be the problem? The problem can be with the tone, that is, there is spastic speech. He is have, secondly, it can be a UMN or LMN speech, that is spastic speech is present in the human speech, or element speech, that is the element signs are present related to the bulbar nerves. Okay. And then you can see whether he has any cerebellar signs, patient having staccato speech, scanning speech. Patients who are having Parkinson disease, they have the bradykinesia, they have the faint quiet dysphonic speech. So when you are testing dysarthria, how will you test it? You will ask the patient to repeat some of the words. These words you will give him in the difficult words like constitution, monotonous, autobiography, and you can give the sentence like no ifs and or buts. Okay, ask him to repeat all these sentences, then you can see whether the he is able to speak it clearly or not. After giving the words, you can also ask him to repeat the some sounds like which are using lips, like p, b, m. Okay. Then you can ask some sounds which use the tongue, like the, l. Then palate using words like letters like k, g. And then you can ask the patient to cough. First point was you were asking him to repeat the words which were difficult. Secondly, asking him to repeat some sounds. Third is asking the patient to cough and you see the clarity of the cough, whether it is hoarse or not. Then fourth, you are if the patient is having face associated features of facial weakness. Ninth, 10th, 11th, 12th, cranial nerve involvement, any fasciculation in the tongue, any asymmetry in the in palatal bridges. And you can also see whether the what is the gag reflex, what is the jaw jerk. Okay, in the cerebellar speech, cerebellar dysarthria, you can also see whether what is the malady, whether the prosody is maintained or not. Okay. Hello friends, welcome to my channel Neurology Videos Learn by Seeing. If you are tuning to this channel first time, subscribe the channel to get the maximum neurology videos and press the bell button to get the notification of each and every video.